Regarding vitamin D, it's a natural steroid. 7-hydrocholecalciferol is converted into 225 in liver, and then 1 hydroxylated in kidney to produce 125 hydroxylated cholecalciferol. In the blood, it increases the calcium and increases the phosphate. Regarding the bone, it promotes mineralization of osteoid, maintain serum calcium level by activating osteoclast for bone resorption. GI tract increase absorption of calcium and phosphate, and kidney decrease calcium and phosphate excretion. Regarding calcium metabolism, 99% of the bone of the calcium is in the skeleton itself as a form of hydroxyapatite. Only 1% is out in the plasma. The concentration is 2.2 to 2.6 millimole. 55% of the plasma is ionized, and 45% is bound to the protein, which decreases with low albumin. Regarding the requirements for postmenopausal women and or pregnant, it's 1500 milligram per day requirement. Lactating mother 2000, adults 750 milligram per day, and rickets needs 5000 milligram per day. Function of calcium is first is gives the compressive strength to the bone. Second is muscle contraction and nerve contraction and coagulation as well. Talking about hypercalcemia. Hypercalcemia is the cause can be a bone cancer, hyperparathyroidism, vitamin D mediated toxicity or immobilization, or Paget disease, or genetic like familial hypercalcemia. Symptoms are polyuria, polydipsia, confusion, muscle weakness, and constipation, peptic ulcer, and pancreatitis. Treatment is hydration, which increases the filtration of calcium, diuretics, which inhibits calcium resorption, IV bisphosphonates, dialysis. Regarding the hypocalcemia, it can happen with vitamin D deficiency, renal failure, hypoparathyroidism, or pseudohypoparathyroidism, or pancreatitis. Symptoms is paresthesias, convulsion, mood swings, trousseau sign, that is carpopedal spasm after BP cuff inflated, and chopstick sign, facial muscle contraction by tapping the facial nerve. Treatment is calcium gluconate.